Diane Perlman. Speaking to the mic.
In the mic.
In the mic. Okay. I guess my question to you is, well, to preface it, the conversations on fixing Medicare and Social Security rest on fixing it and taking things from it and moving money around, and the Paul Ryan thing, and maybe privatizing it, and vouchers, and this and that and the other thing. And even the Simpson Bowls was about fixing it, changing it, and accommodating this one thing that I think would fix it, but then of course I'm not in this business. Well, I'm in the medical business, but not in this. If Medicare and Social Security taxes were paid on wages over $109,000, it would be fixed. $109,000 was the limit set in the 1930s. It is now 2012. And not only that, but I really think that on things like carried interest as an income that pays no taxes, or interest, or dividends, or rent, or whatever, if Social Security tax and Medicare taxes were charged on those incomes, there would be no need to privatize it. There would be no need for vouchers. There would be no need for limits. There would be no need for any of that stuff. Or that's, so I want you to fight that fight. I am a Medicare provider, and I understand. I just realized that over the last 3 years, my fees have been cut by $11 an hour. And I called Medicare about that, and they said, well, it was talk to your congressman.
Thank you. Thank you. So I'm glad this has come up, because you heard me all allude to this earlier, which is that when we talk about getting our long-term budget in order, we need to start with what are the biggest problems to be solved. And they are, in this order, Medicare and Social Security. People who talk about earmarks, fine, let's talk about earmarks, let's talk about foreign aid, let's talk about Pell Grants, practically rounding errors on the long-term fiscal challenge we have. Medicare and Social Security are not. I supported the Simpson-Bowles proposal, which I will tell you was a little vague on Medicare reform, because at the foundation of the Simpson-Bowles committee were a couple of principles, including one, which is that the least advantaged people in our society would not be asked to shoulder the burden of fiscal adjustment. And that's terribly important, I think, to how we think about Medicare and Social Security. Some of our seniors are quite wealthy. Some of them are not. And by the way, it became sort of a bumper sticker during the presidential primary for Republican presidential candidates to say it's a Ponzi scheme, talking about Social Security. Make no mistake about one of the dramatic, and look, I will tell you exactly what the unfunded liability is with Medicare and how deadly serious it is that we deal with that. But make no mistake that one of the true great national accomplishments of this country was that 70 years ago, poverty was concentrated in our most senior citizens. If you were old, you were probably poor. There was no Medicare. If you needed a lot of medication, you were probably giving up food. We changed all that in the space of a couple of generations, and that is a monumental accomplishment for this country. It needs to be fixed. It needs to be fixed for a bunch of reasons. One, our country is aging. There are far fewer younger people, let's call it under whatever, pick your number, 50, working to pay into the system which pays money out through Social Security, Medicare, to our retirees. And by the way, as a democratic system, it is an awful lot easier for the United States Congress when somebody comes in and says Medicare needs to cover A, B, and C. It's an awful lot easier for elected officials to say yes to that than no. And this is why that conversation that we had over here with Dr. Feeney was important. Because we do need some mechanism that says Medicare doesn't cover everything for everybody at all times. I mean, I guess we could say that, but then it will have obviously very real implications for the cost of that program. Now, Social Security, and let me try to wind this up quickly because I know we've got a lot of questions. Social Security is, relatively speaking, easy to fix. We did it in 1986. Tip O'Neill and Ronald Reagan got together, and if I may draw a cartoon for you, the Democrats all said exactly the argument that you heard Mrs. Friedman, I forget the name, make, which is you should raise the cap on wages so that if you make more than X, you're still having Social Security funds withheld. And the right was, and this is a cartoon, saying, no, we should raise the retirement age. And guess what? There was a compromise, and in 1986, the retirement age moved out very, very slowly and very gently, and the cap was raised. So some combination of those things will be implemented to address Social Security. Medicare is much more challenging. Medicare, of course, sits on top of a healthcare system whose costs over 30, 40 years have been going up 8, 9, 10, 11% a year. And of course, with our population aging, Medicare is much more challenging, which is why the answer there is to finish the reform of this system, to make it more efficient. You all know the numbers. We spend 2 times per person what other industrial countries do, and we get worse results in combination. That's the very definition of inefficiency. So there is money to be found if we go into that system and say, hey, what if we paid doctors the way we pay businessmen, which is you get paid for good results, not for doing more stuff. I'm just making some stuff up here. I can go on at length about how you reform this stuff. I'm not making stuff up. I'm picking one particular element that needs to be reformed. What I don't support, and by the way, you know, this won't appeal to everybody in the room, Congressman Ryan put forward a plan that was effective in dealing with the federal expense of Medicare. And he did it by basically capping the guarantee to our senior citizens, saying, today your health care, Mr. Senior Citizen, costs $9,000. Here's a $9,000 credit to go pay for it. Okay, in year 1, that's pretty good. However, the magic here is that that credit grew at the rate of consumer price inflation, CPI, 2–3% a year. Does anybody remember that healthcare is growing at 8, 9, 10% a year? There is a gap there. The effect of that is that 10 years from now, the CBO estimated that the average senior citizen would be going out of pocket something like $6,000, $7,000, $8,000 a year. Now, many senior citizens can afford that. Some cannot. So I object to Congressman Ryan's proposal. And look, the guy went in and made a proposal on Medicare. He gets a certain amount of points just for doing that because, as they've said for a long time, Medicare is the third rail of politics. You touch it and you die. However, I object to it on laziness grounds. It's not hard to fix a problem by just saying, you all are going to pay more for it and we're going to pay less. The answer has got to be the whole system is going to become more efficient so that you as a senior citizen who doesn't have any money 10 years from now can still get access to the critical and effective, Dr. Feeney, treatments and pharmaceuticals and whatnot that you need, and we don't have to put the burden back on seniors who may not have the money to pay for it.